I'm Eric Gandino, the Jones Institute Europe instructor, and today with Diego, my colleague, I'm going to show you 7 different ways to approach the Quadratus Lomborum. So 7 different techniques for the Quadratus Lomborum. First of all, I want to go through very fast some details about the Quadratus Lomborum muscle. The Quadratus Lomborum muscle, as you all know, has 3 fibers. One fiber originates from the lower part of the last rib, of the 12th rib, and goes straight down. Another component of the muscle originates from the inner side of the ilium crest and goes straight up. And a third fiber goes sideways, originating from the transverse processes. All these 3 layers fuse together in the Quadratus Lomborum muscle, which action is to side bends towards. Now, the majority of the time, the pain of the patient is right in the Quadratus Lomborum muscle, and it's provoked mainly by side bending away. But some other times, due to the different direction of these fibers, pain can be elicited by side bending towards or by flexion and extension. Some other times no movement produces pain, and the pain could be just referred to the buttock area. Other times the patient can feel like a compression on the lumbar area or weakness of the region. Even turning on one side or the other side in the bed could be painful if you have a Quadratus Lomborum dysfunction. Apart from that, you can even have pain on the testis and all the other aspects that the Quadratus Lomborum muscle can give. Okay, now we're gonna go through the different technique for the Quadratus Lomborum. As I told you before, 7 technique. Please, Diego. Now let's presume that Diego has a dysfunction on his left. We know that many times the dysfunction could be on both sides, so you're gonna start on the worst dysfunction first. So if Diego has a dysfunction here, the classical technique taught by Randall. So the first technique is this. We side bend towards the side. We just align the other side so that there's no pain on the other side. We contact the tender point. We get the leg out of the bed. And this is what you've been taught for the Quadratus Lomborum. So this is the first Quadratus Lomborum technique. The second technique is head technique. And the technique is performed this way. We have the patient that has to scoop over, that has to drop his leg down. We're going to side bend him towards the side. Place his hand here or on the leg of the operator. And we can side bend more and crunch the last ribs with the buttock area. And in this way, we can, of course, shorten the Quadratus Lomborum muscle. With this technique, you can even adjust other dysfunction. So this technique is used for the terrible quadratus inferior, which is piriformis dysfunction, lower pole 5 dysfunction, Quadratus Lomborum, and flexed L2. So this is the second technique, Ed's technique. The third technique, it's my technique. So it's known as Eric's technique, which is performed this way. You side bend as usual to the affected side. You get the leg of the patient out of the bed. You place your other thigh here so that his leg can rest over your thigh. You use your other thigh to push up or down his ilium. You monitor the dysfunction with your index and you place the other fingers on the last ribs. This means that you can push with your thigh, adjust with your hand, so to shorten the muscle, and adjust even more with all the other fingers, pressing the rib cage down. So by doing this, and doing this, you can perform all the, you can adjust all the fibers of the muscle, and you can even use again your hand this way to finally tune and adjust the dysfunction. The fourth technique that you can use is the same as you can use for the floating ribs. You side bend the patient to the side, you hold the dysfunction point, and you just bring the crest, the ilium crest, towards the dysfunction. And with this other hand, again, you can lower the rib cage down and fine tune for the dysfunction. I usually use my technique, Eric's technique, and even this technique. These are the two I mainly use for the Quadratus Lomborum. A fifth technique could be performed on the side. You need a big pillow so that your patient can rest on the pillow. Be careful just not to stretch too much the other side. And in this way, as you can see, already the Quadratus Lomborum is flexed toward the dysfunction. So you can just crunch a little bit more, monitoring with your finger and fine-tuning for the dysfunction. Your sixth technique could be performed on the side. You can use your opposite leg to side bend toward the side, like when you treat the ribs, or you can just put a small wedge pillow underneath his buttock so that he can bend towards the side. You monitor the point and you just side bend toward, and then you can adjust. Or if you need more side bending, you can just get the other, your hand under the other axilla, and you can side bend toward the side. Your seventh and last technique could be the same technique that you use for an AT12. Instead of monitoring for the AT12, you just go behind, underneath, and you're going to contact the transverse processes, and you can monitor your Quadratus Lomborum from there and perform the same technique. So you can rotate gently and side bend mainly towards the dysfunction this side, and you can adjust the dysfunction this way. Hope this video is useful for all my colleagues in Europe and in the United States. See you soon. Thanks, Eric and Diego.